Now, if you've seen any of my other videos, you will note that I don't have a lot of like for the profession of physical therapy, even though I stayed in it for 25 years. And I have very cold, hard truths on why I don't like the profession for the most part. I shouldn't say not liking the profession of physical therapy because the job part I do like, or did like. I'm mostly retired now. But it was the decades-long battle with the corruption of this field and most dishonest practitioners where I'm drawing this from. I say over and over in the other videos that we're basically dishonest about everything in this profession. Oh, how can you make that global assessment? Well, in this video I'm going to break it down point by point, what exactly we're dishonest about. And you tell me it isn't just about everything. And I'm not talking to all the practitioners out there, and the ones who are honest and practicing in the correct manner, they know I'm not talking about them. But first of all, let's start with your accolades. And yes, I'm talking about the doctorate. You keep trying to present yourself to the public like you are a specialty doctor. You are not a specialty doctor. You did not go to medical school. You are not primary in healthcare. You're ancillary. I have a whole video on the doctorate program itself and why it's only legitimate on paper. I show point by point what a graduate student does and what a PT student does. And guess what? The PT student does nothing that the graduate student does. In quick synopsis, your thesis isn't nearly on the caliber of a graduate student. The graduate student starts his thesis after the coursework is done. The graduate student takes months to put together a committee and months to even get his topic accepted. Graduate student has to submit multiple papers on his methodology, and 50% don't make it through their first defense. That does not happen in PT school. You have a watered-down version of a thesis trying to equate to graduate school, which it is not. You also don't teach lower-level courses, you don't do orals, and no, your end of term in some of these schools and question-answer period in preparation for the boards does not equate to orals of a real graduate student. And you're not an advanced degree, in which I've heard the rebuttal, but we're a clinical doctorate. No, a clinical doctorate is an advanced degree. You are entry level. And the fact that you're entry level calling it a doctorate makes it an oxymoron from the get-go. It's dishonest, period. Every time you walk up to a patient and you say, I'm Dr. So-and-so, you're being absolutely dishonest. But there's other training in this profession that notes dishonesty as well. One of them is a fellowship residencies, which they are not. How do I know that? I went to one for 3 months and I left because it was a waste of my time. I have a whole video on that topic as well, but again, in synopsis, basically what we did is we worked in the hospital. We had 4 hours a week of mentoring. Half the patients didn't even show up, so that was half and half at best. We had 2 courses during the week. One of the courses was a complete waste of time because all we did is research projects, and then we listened to each other's research projects. Seriously. No lecture, no instruction, no testing, just simply listening to each other's projects. As I said in that video, that doesn't even rate an undergraduate class, let alone one that's supposed to be postgraduate. And the other course was on basically joint mobilizations. It wasn't bad, but I could have and did get the same through the Maitland series of courses I took later once I left the fellowship. And basically the rest, just working in the hospital. It was a giant check the block. It did not equate to what a doctor goes through in a fellowship. It didn't equate to what a literary student does in a fellowship. It could have been if it was done right, but please note that they told me the fellowship I went to, which I won't name, the university finally shut it down, but they said this was not only one of the best in the country, many people told me it was the best in the country. I can't imagine the check the block the others resemble. Let's see, what else? There's some therapists who are carrying that DIP next to their initials. I didn't even know what that was the first couple years out, and I looked it up. It stands for diploma. It is not a diploma. It is a certification. It is a series of courses, usually once a month or once every other month for 1 to 2 years. I would equate that to some IT guy who gets a certification in another tech language and adds that to his resume, but it's not another degree. And you have these PTs out there that are spouting off trying to portray that it is. The DIP is just a minor point, but do you see the trend here with physical therapists? But it all falls under the umbrella of you're trying to portray to the public that you're not an ancillary profession when you are. Doctors PAs, nurses are primary, PTs, ancillary. I think we all found that out during the initial phase of the COVID epidemic when many PTs were laid off and many clinics shut down and they only took very essential patients. I don't remember any nurses being laid off because in the grand universe of healthcare, physical therapy is a distant orbiting planet. Doesn't mean we're not important, but we're not central. And my problem is you're trying to portray like we are with this whole ruse of us being specialty doctors. But outside of all that dishonest patting yourself on the back PTs, the real issue of your dishonesty is the way you practice. In your outpatient clinics, most PTs are seeing multiple patients at a time. Completely dishonest, period. That's it. Patients are coming to you because they think you're going to solve their problems, and usually those are pain complaint problems. If all you're doing is running a few patients at a time under your umbrella, basically doing the same exercises, one, you're not giving real physical therapy to them, and I don't care what you say or how you try to explain it. And if some of your patients are getting better with this, I would say, well, yes, many people get better if you throw any type of exercise at them, but they could do this at home. Because if that's all you're doing, and that is all you're doing if you're seeing multiple patients at the same time, there is no reason for them to come in and just go through their program, in which you're going to tell me, oh no, we need to do adjustments here and there to their exercise program, in which I would counter, fine, have them come in about once every 2 weeks then if you need to adjust their home exercise program. They don't need to come in while 2 or 3 other people are engaging with the therapist and basically just do their exercises. And you're being dishonest with yourself because you're not improving your skill set one iota if this is the way you're operating. Let's say you take a bunch of Maitland or Mulligan or Sarman or what have you, and you're not using that on the patient. Why? Because you don't have time. As a matter of fact, my final clinical instructor told me that in her final critique. I'm really glad you're here as a student because now I get to practice my Maitland. In which I said, how come you're not practicing it all the time? And she said, well, I don't have time because usually I'm overlapping patients. I said, then you're withholding treatment. No, you don't understand. That's just the way the system is. No, I wasn't a 22-year-old student. I was 31 at the time, and I told her that you are not operating ethically. I said that as a student to my clinical instructor, my final rotation. That is a form of dishonesty. You know what you should be doing, but you're not doing it because you're too afraid to stand up for the right thing, and that's most of you out there, period. As a matter of fact, for those of you operating like this, calling yourself a physical therapist to your patient is dishonest because you're not even a glorified athletic trainer. You know why? Because at least the athletic trainer sees his clients one-on-one. Really, I want to hear below down in the comments how you defend this point. Because the practitioners who are doing it right, the few of us, they're going to tell you the same thing. And also, in terms of your treatment, you're completely dishonest by continuing to see the continuous chronic pain patient. You can't resolve them. You know you can't resolve them. And the reason you can't resolve them most of the time is due to their poor lifestyle. And even if they do have polymyalgia rheumatica or lupus and they're having flare-ups, there's really nothing you can do about that. They have to live with those flare-ups as they come. You taking those patients for 4 to 6 weeks and pretending like you're doing something is completely dishonest. You take a patient who's having chronic pain because of their obesity, because of their sedentary lifestyle, because of their chronic anxiety, or a combination of the above, and you act like what you're going to do this time is going to somehow have a different outcome from what you did last time. Completely dishonest. Because what you should be doing ethically is discharging these patients and not taking them back and telling the doctor they are unresolvable. And you're not only being dishonest in the clinic, you're being fraudulent with the insurance companies. You are pillaging them for money. You are stealing their money. You are stealing their money under the guise that you're helping these patients resolve their pain when you know you're not. And you know what? I can't even get any of you to admit that in the clinic, so I'm not thinking that you're going to turn around and start doing the right thing on that front. I see this all the time in the clinics. Oh, I'm solving my patients, and then I go back and look at their history, and they are not. The patient has 2 out of 10 pain one day, they have 8 out of 10 pain the next visit, one visit they have 5 out of 10 pain, but the point is the pain is always there because of their lifestyle or some ailment that you can't solve. Complete dishonesty, period. That's it. And that's most of you out there. But again, most of you are deluded, so you can't even admit this out loud. And that's my problem with most of you PTs out there. None of you can admit it out loud. None of you can admit anything about our field out loud, and if you do admit it, you certainly aren't going to do something about it. Do you know who the person is in the clinic that usually stands up and says, I'm not going to operate unethically? It's me, sorry, and I'm usually the only one. There are very few therapists out there that I have learned to respect because there's so few of you who are actually doing the right thing. Don't blame me for my contempt when you're not doing the right thing and you're completely dishonest on all the points above. So there it is, PTs, all the specific points on why this field is so globally dishonest. Really, I want to hear your rebuttals. I want to hear you counter what I said isn't true. So go ahead and start filling the comments with the how dare yous. Start telling me if I don't like the field, maybe I should just leave. I have a better idea. Maybe you should start acting ethically. Maybe you should start acting honestly. And honestly, go ahead and fill it with hateful comments. I'm mostly retired. I don't care. But I tell you what, I am mostly out of the field, but I am hearing more and more from young therapists on the forums and on YouTube how miserable they are in the field. This is what happens when you're dishonest for decades. Now you're in a working environment that makes you miserable. They're having to do all this documentation on their off time in the evenings and on weekends because they're seeing all these multiple patients. Their energy is constantly being drained by all these continuous chronic pain patients that they know they can't solve, which has become the new cash cow in physical therapy. Young therapists are leaving the field at 3 to 5 years. What does that tell you? I was in a heated argument with my clinical instructor in the final rotation before I graduated. Because she was wrong. She wrote in my final feedback, you should be positive about the field. Negativity doesn't help. No, not acknowledging problems doesn't help. And if those problems are negative, well then they are. Solve them. Our profession has hit rock bottom because for so many decades, no one has acknowledged these problems. And like I said, even if you acknowledge them, most therapists don't have the intestinal fortitude to actually do something about them. Physical therapists, change the way you're doing things.